is Dr. Salim Masoud. I'm a pulmonologist, and today, partnering with Ponea Health Limited, we want to discuss some of the respiratory conditions and the common respiratory conditions, so including asthma, TB, pneumonia, cancers, and other respiratory diseases. What does a pulmonologist do? So a pulmonologist is referred in other places to as a chest physician or a respiratory medicine physician, and we essentially deal with diseases and the health of the respiratory system. So the respiratory system includes the airways, which takes air in and out of the lungs, also the lung itself, and there are other structures associated with the lungs, like the diaphragm, the blood vessels, the blood circulation in the lungs, and the chest cavity. So that's what we deal with as a pulmonologist. What are the common respiratory conditions that I come across in the daily practice according to various age conditions? The common conditions are essentially infections comes first. They're very common. So respiratory infections are very common, and these could be viral, could be bacteria, or any other infections, and this cuts across all the ages. And the other condition that we come across more commonly, what are called airway diseases. So diseases that affect the airways, like asthma and COPD. And this also cuts across all ages. For asthma, it's more common in the younger population than the older population. And the cousin, what we call COPD, is more common in the older population than the younger population. And we also see other diseases. Currently, we have COVID, which is also very common, and it's more common in old, not the so young people. We don't see COVID a lot in the younger population. So those are the conditions I can mention we see most commonly with us. What is respiratory distress syndrome? So respiratory distress syndrome, it's a condition that causes respiratory distress, as it says. And basically what that means is difficulty in breathing. And this happens as a result of some changes that happen in the lungs, also as a result of some several insults. So for respiratory distress syndrome, the insult is usually, or the response from the lung as a result of the insult is usually severe until to the extent that the patient finds it very difficult to breathe and get air in and out of the lungs. So what happens is there's a delicate protective lining in the air sacs in the lungs. And when this lining is disrupted or interfered with by anything, then ends up causing problems in breathing, and ends up causing some leakage of fluid into the lungs. And this is the one which causes difficulty in breathing. So it might happen as a result also, maybe, for example, in premature babies, this protective delicate lining may not have developed enough, and when babies are born prematurely, then they may find it difficult to breathe because they don't have this protective lining. For mature and older maybe patients, this might happen as a result of disruption of this lining by either insults, maybe noxious gases from outside, inhaling noxious gases, or even severe infections like pneumonia, severe conditions like trauma, like burns, severe diseases like pancreatitis, And major injuries, like if you have a body crash injury, it can also as well affect this protective lining in the lung and cause to have acute respiratory distress syndrome. So what age group is generally affected for respiratory distress syndrome? All age groups are affected. So it doesn't have a specific age group, but the causes of the respiratory distress syndrome may change from one age group to another. Like I said, prematurity, for example, is specifically for premature babies, but the other causes might cut across all the age groups. That includes pneumonias, burns, and traumas, pancreatitis. All these might cut across all age groups. The predisposing factors to acute distress syndrome are the ones I have listed. So immature lung development, for example, in prematurity is one. And then severity of the insult also will affect, because, for example, not all pneumonias will end up giving you respiratory distress syndrome. It's only the severe pneumonia will give you respiratory distress syndrome. Not all trauma, not all burns, not all pancreatitis will give you respiratory distress syndrome. So it's only the severe forms of diseases will give you the respiratory distress syndrome. I want to thank you for listening to these sessions with Ponea Healthcare. And if there's any more inquiries, any more information necessary, we can always provide. You can book our clinic or our services through Ponea Healthcare platform, and then we can connect and discuss more. We're looking forward to more sessions like this one, and trying to educate patients and inform them of what is available in terms of respiratory health care. Thank you very much, and have a good day.